the single most terrifying day that kid's ever experienced. You could see that he was just the wrong colour. As soon as he walked through ED, you could tell that kid wasn't right.
Because you're quite unwell, we're probably going to give you some antibiotics and get you a chest x-ray. Because you've had a fever, we're going to assume you have an infection.
The skin over the top here, that's all dead because it's been separated off, and that's why it's just come away with that bandage.
Oh yeah. This is Beryl.
Hello, Beryl. My name's James, I'm one of the doctors. I've got Katie with me.
Keep spitting it out, darling, all right? Don't swallow it.
Ready, steady, lift. Sit you up a little bit, Beryl, my love. There we go.
Having better. There we go. This lady's on a Pixaban.
Okay.
Sudden nosebleed. The sanitary pads you can see in there.
Yeah.
There's 9 of them in the sink, saturated in blood.
Okay.
No AF. BP's been fine. No nausea, no lightheadedness. She was a bit clammy. She looked quite pale. Yeah. But it was just the amount of blood.
Beryl's blood-thinning medication is stopping her blood from clotting. Without intervention, her condition may become life-threatening.
People have died from just bleeding out through a nosebleed. So it's like anything, if you can't stop the bleeding, then you'll come to a point when everything will stop. And so it's all coming from your nose, is it, Beryl, down into your mouth?
I'm not sure.
And is it both sides of your nose, or?
We've had to undress her and change her. She was saturated in blood, loads of big clots as well.
Right, yeah.
Straight in this arm, my darling. I know you've got a lot going on.
Dr. Griffiths needs to stop the flow immediately.
What I'm going to do, Beryl, is I'm going to pop 2 packs into your nose to stop the bleeding.
Yes.
It's quite uncomfortable, but it'll stop all that blood, all right?
Yeah.
So make your eyes water,
Yeah.
but you'll feel a bit better afterwards.
Thank you.
Right, Beryl, this is the first one, so just rest your head back for me. That's fantastic. OK, doing really well. Nice deep breathe. Open your mouth and breathe through your mouth. That's it, keep your mouth open. It is one of the most painful things we do to patients within the emergency department, unfortunately. It really does make their eyes water. It's one of those necessary evils, I'm afraid, in order to stop the bleeding.
Doing really well, sweetheart.
For me. Oh, Beryl, you're an absolute superstar, well done.
Beryl's shivering could be a sign her body is about to go into shock. If Beryl loses too much blood, she'll need an urgent transfusion.
Does it feel like it's slowing down at all, Beryl?
Yes, I think it's it.
Yeah? OK, excellent. Well, we'll check all your blood tests. We might need to give you something to reverse the medication that you take to thin your blood.
Yes.
We might need to give something just to counteract that. The more elderly patients, I just think they're an incredible generation. You know, they're really stoic, they don't want to bother anyone. Poor old Beryl in resus, bless her, really didn't want to make a fuss. Hi, Switch, it's James Griffiths, the A&E consultant. Is it possible to put me through to the consultant haematologist on call, please?
Right, so...
Thanks very much.
Okay. Yeah, I think as far as we know, I think you just got 2 rapid dry notes. I think she was so brave. Ooh, everything we're out of it.
She was brave, I'd have cried.
Where you're going to see it?
How old are you?
91.
91?
I'm going to get my colleagues from ear, nose and throat to come and have a look at you. You'll need to stop in at least overnight.
Yes.
But we'll go from there, all right?
Yes.
Fantastic.
Beryl has already lost 20% of her blood. If she loses any more, she'll need a transfusion.
My name is Elizabeth, one of the doctors from ear, nose and throat department.
Yeah.
Okay. The doctors have put this packs in, but I'm not happy with the way they are seated. So I'm going to have to push it further in. Okay? It's not going to be comfortable. I'm so sorry. Now I'm going to push it further in, okay? Just bear with me. Hold my hand. Hold on. I'm so sorry. It's sitting better now. Sits a lot better now. Around your nose and your mouth. She's laughing. That's a good sign.
It is. There. Yeah, just pick it off there.
You're stopping with us, I'm afraid. We'll keep an eye on you.
Yeah.
We'll give you some pain relief. You should feel more comfortable afterwards, okay?
Yes, thank
I'm
you.
sorry I did that to you. I had to.
Beryl needed a blood transfusion. 10 days later, she was discharged and is recovering at home. Dr. Greer heads straight to his next patient, 25-year-old Alex, who's dislocated her shoulder.
At the gym, doing handstand walks.
Have you dislocated it before?
Never.
Never.
It sometimes slips, but goes back in sometimes, but it's never gone out completely. Unbelievable pain, this.
Dr. Greer needs to manipulate Alex's shoulder back into place, but it's a painful process.
This is Pancrux, and it's only as good as the person who's using it.
Okay.
All right, and that's your key. Okay. So the key thing, you put it in your mouth, and you imagine you fill up your lungs with it. Okay. Fill those lungs up. Big breaths. That's it. I want you to take 20 of them for me. And all I'm going to do is just give you a free massage.
Okay.
Brilliant. You're doing really well.
The pain is proving too much for Alex. If Dr. Greer can't reset her arm, the only option will be to sedate her.
You want to lie down a little bit?
As the drugs take effect, Alex's enthusiasm for exercise returns.
Yeah, that's the thing for CrossFit. You have to keep going. The first thing is one of those things you have to keep going. The more you do it, the more you'll be better.
Alex is now sedated. Dr. Greer needs to manipulate her shoulder back into place.
Put your head back onto my hand. You want to take your hands. Okay. She's just very.
The procedure is successful, and most importantly for Alex, painless. Just 2 hours after arriving, Alex is discharged. She was back in the gym the next day. Ambulance patients queue, but emergencies are prioritised. 71-year-old Anne is next to be seen. Her dog collided into a leg over a week ago, rupturing a blood vessel, but the wound has got much worse.
Just give me a date of birth, please.
Sister Jo wants consultant Dr. Julian Humphrey to take a look immediately.
What did the dog do to your leg?
She went straight into my leg, bounced off, back into the room. Oh, so I'm playing out here. I'd only a little bump like that. And before I knew where I was, it was a great mess.
Can we have a little look at it then? Let me just go and get something to put underneath. I will, yeah.
So just relax your leg, it's all right, because you've got this stuff here, don't stick to it, so it should lift off quite easily.
All of this here is blood clot, a bit like black pudding, all right? And really, it needs to be got rid of, okay? The skin over the top here, that's all dead because it's been separated off, and that's why it's just come away with that bandage. This clot will potentially become infected very quickly if it's left any longer, and that will cause then a septicemia and a systemic infection if it's not treated, which will be potentially pretty serious in someone of her age. What I think we need to try and do is put a little knife along here and just split the skin and then try and milk some of this clot off, okay? That clot starting to smell a bit now is just going to cause an infection if it stays there.
With the risk of infection so high, Dr. Humphrey will need to operate straight away.
There you go. We'll wait for Doctor coming back in and...
Right, okay.
Dr. Humphrey wants to remove the clots immediately.
chop it up, are you?
No, I am not going to chop it off. I'm going to tidy it up best I can. When a doctor tells you that he's going to take a knife to your leg in this cubicle right now, that's quite intimidating. Right, what I want you to do is I want you to tell me if you feel any pain, all right? You feeling anything? No, I think it's the answer to that. Right, this is the moment of truth. Right.
Going ever so well, just keep taking nice deep breaths on that.
Nearly finished.
Two kids.
Yeah.
6 grandchildren, 18 great-grandchildren.
Wow.
Keep breathing on that stuff. We're nearly finished.
Do you remember all the birthdays as well?
No, but more
Think I don't think I've got that many.
Do you want to just dress it now?
You've done absolutely amazing now.
She has. She's been a legend.
Definitely.
I'm not going to play with that anymore now.
Let go of that.
It is a mess.
You've done a good job, hasn't
Top man.
Good job.
All of this area here will heal up, but it may need to have a skin graft put on it. Because this is a very bad area for healing in the body, that shin. You just relax. I thought she tolerated that very well. What did you think?
Amazing, didn't she? Gosh, so brave.
What about the dressing? Is it all sorted?
Yeah,
It's not bleeding too much. It won't. I don't think it will bleed.
I've just put some trauma dressing on and some gauze and bandaged it.
Since I've done that, does it feel a lot better?
Yes, since you've done that lot. Yeah.
Right. Now, that probably needs dressing again, probably in 24, 48 hours. Because... Of course you can go home, yes.
Bless you.
OK.
After leaving Barnsley Hospital, Anne was referred to plastic surgeons in Sheffield to assess if she needs a skin graft.
Just like go with this for us, love, that's it.
This time, rushing in 67-year-old Phil. After being treated for a urine infection, his condition continued to deteriorate and he was brought in by ambulance.
Morning, this is Phil, I'm 67 years old.
Yeah.
Consultant Dr. Sue Mason is on ambulance admissions.
I love emergency medicine. I like the rapid pace and not knowing what's coming through the door next really excites me and keeps me focused and alert.
Hello there.
Hi.
So I'm Dr. Mason.
Yeah.
Where's your main problem at the moment?
Can't put my foot to the floor and I've got a very bad pain at the bottom of the kidney.
If I wiggle your ankle.
So that's where the pain is there. And onto the side as well. There. Like, that's it.
Have you ever had anything like this before?
No.
Have you ever had gout before?
No.
So it's exquisitely painful when we wiggle it at all.
Yeah.
So this ankle does look more swollen.
Yeah.
And it definitely feels warmer. How do you feel in yourself?
Tired.
Can you lean forwards a little bit? You said it's sore down here.
Yeah.
That's sore. That side okay?
Yeah.
And the neck?
It's just down there.
Okay, let me have a little feel.
Yeah. Yeah. Yeah.
Just relax for me. So I've just had a very brief look at you, but what I think is that you probably have got some sort of nasty infection somewhere going on. May have started in the urine,
Right.
might now be in the kidney,
Right.
but I'm worried also that it's affecting other parts of your body.
Yeah.
So you've got this very, very sensitive ankle joint.
Yeah.
When ankle joints are that painful to movement, usually it's an infection in your joint.
Right.
And I'm worried that you've got some infection in that joint that could have come from where it started here.
Right. From the
Yeah,
infection.
yeah. Sepsis bloods.
Dr. Mason is running more tests. She's concerned that Phil may have sepsis.
Sepsis is an overwhelming infection that takes over the entire body and affects multiple different organs in the body. If sepsis is not identified and treated, patients can die. And the earlier that we can identify those signs and those symptoms in patients, the better for them. We want to get you better quickly if we can. Yeah. All right, lovey?
With the threat of sepsis and how fast it can spread, Phil needs to be treated immediately.
I'm concerned that he's got an infection that may have started in the urine, but it may be spreading to other parts of the body. The concern is that it would become sepsis.
Thank you very much.
Sepsis is a life-threatening infection which needs immediate treatment.
Hello, sir. Is it Philip?
Yeah.
Hello there, my name's Dave, I'm one of the practitioners. We'll get your blood taken.
Nice range.
Aye, I've been eyeing one up already, so... Alright, so why not just pop in this tray here for a minute, is that okay?
That'd be all right there, look. That one, then.
Alright, that's one I've been eyeing up. And sharp scratch.
I've got 4 different things wrong with me in the last couple of days. It's my foot, my groin, all down my neck down here. And now, bottom of my
We're a lot of pain around there, yeah. Right, so we'll get these blood sent off. Not any coughs, colds, anything like that recently? Bit of a cough.
Yeah, and I've got some green off my chest as well.
Any shortness of breath?
Yeah.
How long's that been for?
Well, while I've been like this.
Just while you've been like this. Have a quick listen to your chest. So forward just a little bit for me, so let's have a quick listen around the back. Sorry, sir. Bit of noise around the bottom of this lung there. We'll get an x-ray of your chest, make sure there's no infection sat on your chest as well. Okay. We'll get some antibiotics in you, okay.
Nurse Dave sends off Phil's bloods to be analysed, and he's taken to x-ray to discover if the infection has spread to his lungs.
All right, go.
Nurse Dave has the x-ray and blood test results.
No worries. Hello, sir. How are you doing?
All right.
So, your x-ray looks fine. No change from any previous ones you've had. But your bloods are showing infection that's sort of getting worse, not better. What we'll do, I need to bring you in, sir, because I think we need to give you sort of at least 24 hours of the intravenous antibiotics to get on top of everything and hopefully sort of get your symptoms under control. We'll do another set of bloods then and see how things are going and take it from there. The good news is that all your kidneys and everything are looking like they're functioning as normal and stuff, so that's reassuring. We'll get you upstairs very shortly and get you reviewed up there.
Okay.
All right.
Yeah, thanks very much.
You're welcome.
All right.
Phil was diagnosed with urine and kidney infections and spent 18 days being treated in hospital. It's the start of another 12-hour shift at Barnsley Casualty. Consultant Dr. Julian Humphrey is in charge today, and already there's a massive problem.
We are basically log-jammed. We have the department full of patients. We can't move anybody out because the hospital hasn't got any beds at the moment. Then things back up. When you're leading a team, you really just have to get your head round the priorities in terms of the adversity you're facing.
Yes. Thank you very much. I'll get him up now. Yeah. Very full. Yeah.
As Sister Harriet tries to free up some space, she spots a patient who needs urgent attention.
Come in, Terence. Get you straight on here because you look like you're in a lot of pain, Terence. Which shoulder is it?
Just my left.
Your left. When you're working in A&E, you just have no idea who is going to be walking through the door. He's sat with his arm like this. I don't know what's happening with him. He looks in so much pain, which immediately rings alarm bells. I want to triage you and get you some pain relief. It wasn't actually his turn in the queue, but it was really important that we saw him quickly. What's happened?
I slipped. I was stepping onto a roof off a ladder, 1-storey like roof, and it's been slippery tiles and I fell onto my shoulder.
And how far have you fallen?
3 metre. Well, might be about 5 actually. As high as this roof.
Injury to your shoulder?
Yeah.
You banged your head?
Yeah.
Did you lose consciousness?
No.
I'm mainly worried about the fact he'd fallen from such a height. That could cause any amount of trauma. First of all, this is just paracetamol, but we'll get it in your system, then I've got some medication. It's very, very strong, I promise. So just take these first. Now for the strong stuff, can make you feel a little bit tipsy. What I want you to do is breathe in through this inhaler and back out into the inhaler and just keep breathing, okay? So you didn't lose consciousness, you've fallen, you banged your head, and you've... Have you dislocated your shoulder before?
No, but I think I this time. Definitely I can't put it down.
Keep doing this, because it's keep going, in and out, bigger breaths.
With the pain medication having no effect on Terry, Sister Harriet needs to get him seen by a doctor immediately.
Okay, right, I'm going to go and grab doctor. This is Terence, he's 34 years old and he's gone on a roof and he's slipped off it.
Sister Harriet has called in Registrar Dr. Drew Greer to assess him.
You land, which bit of your body did you hit?
All the 14 stone and flat belly landed.
What was the
on
surface
one
of
side.
the What was the surface of the ground?
Concrete.
Oh, crikey.
Shall I get a cannula in while you talk?
Yeah, let's put a big one in. Right, let's have a look at your buddy. You can have a press on your neck.
Yeah.
Now, if your shoulder is out, I should be able to gently bring your arm down. I'm going to do it slowly. If it gets too much, we just stop, okay?
It doesn't get too much. Oh, it's stuck.
Okay.
Oh.
Do you want to stop on this? Take some big breaths of that.
Straighten your arm.
No, top of my shoulder. No.
Terence, sweetheart, I want to get a cannula in and then we can get you some pain relief.
I've got it, you're alright, buddy.
Keep that arm still, remember. Keep your arm still.
Let me gently take your arm down.
Terence!
Oh, I can't do that whilst I'm doing that, there's no way.
Alright.
Oh, that's it.
Sorry.
Now they've managed to get a cannula into Terry's arm, they can administer stronger pain medication,
That made you feel a bit dizzy, a bit oozy.
which should make him more comfortable as he's taken to X-ray to assess the extent of the damage to his shoulder.
Oh, it's not worked at all, that pain relief.
We'll give you some more when you get back, don't worry. He's got an inferior dislocation, so you can see the proximal part of his humerus here, the head, should actually lie in there.
The X-ray reveals that Terry has an inferior shoulder dislocation, which is incredibly rare and difficult to fix.
I've only seen this once in my career before. As I say, it's quite a rare injury, so we need to take him round to resus and try and reduce it.
With the severity of Terry's dislocation, the only way the doctors can attempt to put it back in place is by sedating him. He's taken to resus.
Say again.
Why the pain relief working?
Because your shoulder's not in the right place, the way it's impinging on your nerves, what's going to get rid of the pain is us putting it back in joint. We're going to make you sleepy to put it back in place.
Once you pop it back in, what pain go or what?
That's the plan, yeah.
I want some monitoring, okay, so we can keep an eye on your heart rate while you're having your sedation.
First time I've dislocated, I think that's worse than a wreck, isn't it?
Is it?
Yeah, I've brought my legs and my arms and handed it like this.
What have you been doing?
Falling off a roof.
Oh dear.
We're going to give you a bit of oxygen in your nose and a bit of oxygen in your mouth.
Lift your head up a little bit for me.
As with everything we do, there's risks associated with it. This is a really rare type of injury. It may be that we can't get your shoulder back in.
If Dr. Greer can't get Terry's arm back in the socket, he'll need urgent surgery. Doctors are preparing to try to put Terry's severely dislocated shoulder back in place.
Hi Terry, I'm Dr. Elise, I'm one of the eye doctors. It's me that's going to be pulling on your shoulder, okay? So Dr. Drew's going to give you all the drugs and I'm going to do the pulling, alright?
If you're trying to reduce one of these rare dislocations, put them back into joint, is very difficult sometimes.
Just relax for me, Terry. That's lovely. You're doing really well.
Because when you pull on it, you're going to have to pull on it with some force, because it is truly jammed.
there. Try going upwards. Yeah.
If you pull too hard, you can break the arm, essentially. So you have to be careful.
To see if you can put it into that. To try and pull it. It won't go back, I'm afraid.
The team are unable to get Terry's shoulder back into its socket. He now needs surgery.
Okay, Terence. Yeah, I think you need to go to operating theatre. Sorry, we tried. We need to get you sorted. All right.
It's just the office, little wipe, and get rid of some of this blood. Make you look a bit smarter before you go to ward.
While he waits to be admitted, Terry calls his wife, Melissa.
Wes?
Yeah?
Can I send out to kids because they're going to be keeping me in?
Kate's asleep, but Nell's here, look.
Good night, Princess.
Taylor, look at Daddy's here.
They're going to be keeping me in. I've got to go for an operation.
What time are you going down?
Tomorrow.
You'll ring me no matter what time you're going down.
I love you.
I love you. Good night. Take
Good
care.
night. Bye.
Your bed's ready on ward now, sweetheart, so we're going to take you up, okay? All right, lovey.
The next morning, surgeons successfully managed to get Terry's shoulder back into its socket. He left the hospital the following day. Paramedics are rushing in with a woman fighting for breath. She's taken straight to resus. Dr. Farraher will be treating her.
When I'm in the moment, there's a big adrenaline rush and everything just sort of happens.
Oh, excellent. Let me pull this up.
So this is Linda. Very recent admissions for breathing. Her oxygen levels when we got to her were between 70 and 75%. That was on her 0.5.
Yeah.
This is the least agitated we've probably been.
Okay, are you all right?
Yeah.
So, I understand you're very short of breath at the minute. Okay, and the pain, have you got pain in your chest?
Just that little bit under here, but I had that last week.
Okay, can I have a listen to these lungs? Deep breaths through your mouth, you know how it goes.
Not being able to breathe is absolutely terrifying. The only time I've ever come close is I got trapped under a surfboard. When I was a kid, being in the water, not knowing what way's up and knowing you can't breathe, and there's a lot of panic in that. I suspect that not being able to breathe properly in air may be worse.
I think what we need to do...
We worry about carbon dioxide levels getting higher. So frequently the first sign is agitation, and then they can actually be less conscious, they can be drowsy, and they can actually end up in a coma.
I need you to stay still, darling. Sat's all over the place. She's really struggling. She's borderline, isn't she? Because you're quite unwell, we're probably going to give you some antibiotics and get you a chest x-ray. Because you've had a fever, we're going to assume you have an infection. Yeah. We can always dial them back later. Right, I'm afraid I'm going to have to stab you twice. Twice.
She tests Linda's blood for signs of an infection.
There is a vein here. Sharp scratch. These ones check for bacteria, so we've got to have enough blood to grow stuff if it's there. You're all right, darling. You're all right.
Linda's carbon dioxide levels are still too high.
The risk is that she doesn't breathe enough to blow off her carbon dioxide, and her carbon dioxide gets higher, and that is very poisonous.
Also treating Linda is Nurse Sophie.
So I've got you some water and then 6 steroids. You're welcome. Take that off for a minute. Thank you.
And does it break up? How long does it take you to break?
You've done this before.
Many times.
The blood results are not yet back.
I have tried to
Am I free to come down to resus for a portable chest, please?
An X-ray is the quickest way of finding out what's happening in Linda's lungs. If Linda's breathing doesn't stabilise soon, her life will be at risk.
Yeah.
X-ray.
Antibiotics over for you. I don't think we're going to be missing anything significant.
Dr. Farraher has the results.
There's a lot of increased lung markings, which are all these fuzzy bits, which can indicate a lot of things. It can be fibrosis, it can be infection, and her blood says she's got an infection, so I'm going to treat her as an infection.
Nurse Sophie checks Linda's obs, and the medication finally appears to be taking effect.
Come down a bit.
Well, it will do, because I think it will, because I was breathing so hard and that, and I couldn't settle down at all, so I think that put it up. Feel a bit on the fraud.
Don't be daft. You're absolutely not a fraud.
How much you were given? Did you just what you did?
Well, my breathing's calmed down a bit.
Your heart rate's come down as well.
Yeah.
You look a lot better. You're not perfect, but we don't need perfect.
I feel a lot better than where I was when I was fetched in, definitely. I'm not right, but I'm getting there. I blame it all on smoking when I was younger, so probably right. So my advice is don't smoke.
Do you have a cup of tea, Linda?
Oh yes, please.
Do you have any sugar or milk?
I have no sugar.
No sugar.
Sweet enough.
You know you're coming into hospital. I think you knew that when you got here, didn't you? We're going to keep an eye on your oxygen because you've crept up again. You've had some antibiotics because we think you've got a chest infection. Okay, your x-ray doesn't look bad.
No.
It looks about the same as the previous one.
Yeah.
Hopefully, we'll just be able to get over this and keep going, all right? Have you got any questions?
No, thank you.
No?
You explained everything to me.
That's fine. Are you okay? All right, Charlie's going to look after you while you're here. I have been informed you should be going up to the ward shortly. Shut this back on. Don't lose your slippers.
No, the smell then. The stink. The new ones are now.
Linda was diagnosed with a chest infection. She was discharged 2 days later and is now back home. 2-year-old Seb has been rushed in with his mum, Cassie.
I know, buddy. Do you want to wear it? Would that be easier?
Dr. Lamar immediately gives him a nebulizer to aid his breathing.
I'm getting a little bit frightened, or if a child looks really poorly, nebulizers are what we go to first. That's really good. I know. As they walked in with Seb, you could see that he was just the wrong colour. You know, he looked a little bit more grey than a normal kid did. He was properly slumped and sort of clinging to mum. As soon as he walked through ED, you could tell that kid wasn't right. So nice big deep breaths, and that'll get the medicine where it needs to go.
Seb's lungs are working harder than they should to get oxygen into his body.
There's a point at which he'll get tired, and he'll struggle to breathe against that very resistant chest. And as he gets tired, he'll just breathe less and less. And what you're worried about then is, rather than a wheezy chest, is a silent chest. So if the wheeze stops, you're in trouble. We'll try a couple more of those nebulizers, but I think he's needing so many of them, he's going to need a little bit more of a look at for a slightly longer time we're going to manage here. So, worst case scenario for Seb is that he gets tired, and at some point he just wouldn't keep up with it, and that's the point of respiratory arrest. There's something really wrong with his breathing.
A little bit of medicine for me. Is that okay? Oh, such a good boy. We're ready. Nice and wide, all in one. You done? Oh, done. Good boy.
Oh, it's a good cough there, Seb. And look, your
I like
breathing
them numbers a bit
still looks a
better
bit
as well.
hard. Can you see what we're looking at,
Yeah.
Mom? So he's sucking in a little bit there.
Yeah.
Seb, can you tip your chin up a little bit?
Good boy.
Dr. Lamar is yet to see an improvement in Seb's condition.
In kids, the breathing can be the problem that's causing everything to go horribly wrong.
If adults get really unwell and have a cardiac arrest, it tends to be heart-related. With children, it tends to be a breathing problem that causes their heart to stop. So, because you've got a bit of a cough and you're struggling with your breathing, we're going to give you some more of that magic medicine. So it'll help your breathing. It was just because he looks so poorly that he's getting numerous nebulizers to make sure he doesn't deteriorate.
Despite the team's best efforts, Seb is still struggling to breathe.
He's still wheezy at the minute, so chances are we'll need to do another one of those after. And I think we might just be back-to-backing them for a while.
This will make you feel lots better. Wowzers, what a superstar. You ready?
Sister Naomi and Dr. Lamar have been giving him a series of nebulizers to open up his lungs.
You've got to bear in mind that it's the single most terrifying day that kid's ever experienced. That'll be the first time he'll have come into ED that he can remember. So it's anything to try and settle him down. Do you want to see a trick?
Yes, please.
Do you want to see a trick? Where's it gone, Annie? Do you know where it's gone? It's just appeared back there. I used to be able to put it in people's ears, but now that's a bit... It's no go anymore, is it?
Paediatric Registrar Dr. Fiona Blythe has come to assess Seb.
You will need to come up to the children's ward, and I've already told them about him, okay? Good boy. And what we'll do is we'll continue that medicine that he started on, but we'll give him a bit more time between the doses now, okay? His chest sounds better than what I believe it was earlier.
Finally, there are signs that the medicine is beginning to work.
That's brilliant. There's no wheeze there at all now, and his air entry is much better throughout. So the medicine has done its trick, hasn't it? Do you want me to sit on my special trolley with you and we'll go for a ride? Yeah, together. Yeah. Oh, and then we're going to go for a big ride.
Seb's breathing difficulties were the result of a viral infection. He was kept in overnight and discharged the following day. He's now home and back to his chatty self.
We got Ethan.
In Paediatric Casualty, a cubicle is freed up and 2-year-old Ethan has come in with his mum Lynn. He's wedged a stone up his nose, and not for the first time.
Right, if you have a little seat in there for me. My name's Chris, I'm one of the doctors.
Trying to remove it is Registrar Dr. Chris Carson.
So this is Ethan. And who's this?
Who's this?
Is it Mummy?
Yeah.
Nice to meet you. And we've put a stone up our nose.
Again?
Oh, again. This is his favourite hiding place. So if a child comes into A&E with something up their nose, you go through two kind of emotions. There's like, oh, cool, yeah, I can pull that out. And then you remember all the times that you failed to pull it out and the trauma that you've put a child through. Do you know how long it's been up there, roughly?
About 2 hours.
2 hours? This big, kind of large. Which nostril are we looking at then?
His right nostril.
His right one. Let me get some equipment. Suction might work. Try and suck it out. If that doesn't work, ENT. I mean, you know the drill. Let's have a little look up there. You feel like a complete failure whenever you have to ask the ear, nose and throat doctors to have a go. Right, whenever you're ready, we can take our time. Oh, good boy. Well done. And it's the right one. Good man. Good man. Ethan is not happy with me. I don't think I'm going to be friends. I don't think I'm going to get a birthday or a Christmas card. He is screaming the house out. We can have a cuddle, yeah. Oh.
The suction has failed, so with the help of Sister Emma, Dr. Carson has one final procedure to try.
Who's this? We've got Emma. Something we try is something called mother's kiss. And that's basically where a parent or a guardian puts their mouth over the child's mouth and blows hard, hoping that the pressure from the air will just blow it out of their nose.
issue.
All right, we're all done. We're all done. That was traumatic. I failed. I'll chalk that one down to experience. You know, next time I'll get it, hopefully. You know, you can't get the ball. That just doesn't want to come. It's trouble, the bigger they get, the harder they fight. All right, we'll have to get you to ENT then. I'm sorry. Hello ENT, it's Chris, one of the A&E registrars. I've got a little paediatric one for you. It's a foreign body stuck in the nose. Thanks very much. Cheers. Bye. Bye.
Ethan was transferred to the ear, nose and throat department, where the stone was successfully removed using forceps after they numbed his nose.
Good man. You're welcome.